I was asked if I have a favorite period during my long career and what I was doing during that time. And I thought about it, and I really couldn't narrow it down to one, because each place I worked had favorite aspects to it. So when I started at Patton, I was brand new as a music therapist. It was such an exciting time to learn my profession, to connect with other people who were doing similar work, and we had a lot of great get-togethers outside of work. It was a very social time, so really enjoyed those years. Similarly, during that 10-year stretch at Vacaville, there were just many aspects that were exciting, and it was a big life change time for me, because those are the years when both of my kids were born. So I had that as well, with just major family change and all that comes along with that. So that was really exciting, and just a lot of good memories, wonderful people I worked with during that time period. And then that was the first place that I was hiring people. So to have that experience of bringing someone into the workforce, training them, seeing how they progressed and grew, and then over the years, quite a few of those people ended up spending their whole career with DMH/DSH, and some of them have already retired and were program directors or clinical administrators, so that was exciting too, to see the progress in other people's lives and careers that I had a part in. There were a lot of things I really enjoyed about those Napa years. That the state hospitals have such a wonderful culture. Napa in particular just really connected with patients and families. They had an annual Thanksgiving luncheon where patient families could come. You had the whole hospital behind that in working at that event, shuttling family members in golf carts down to the dining room where the luncheon was held, providing entertainment. It was just wonderful. And there were so many of those kinds of activities that happened throughout the year. So in addition to just the regular work, there was just this environment of social connection and uplifting activities for the patients and the staff. And so I really enjoyed that as well. Having these last few years in Sacramento has been a major shift, and also was a really nice opportunity to learn a whole different way of working. I had not had exposure to the whole legislative and budget process. I mean, I worked with budgets in being an executive director and managing a program, but to understand what is behind that at the Sacramento level, and all of the dynamics of that has been just fascinating. And I can think back to those days when staff at the hospitals would be like, why can't we get money for this? And why don't they hire more people? And I mean, I get it now, because I know how hard it is and all the steps you go through just to get a handful of positions. But this department has done just incredible work in what has been accomplished with adding programs and positions over the past 5-6 years that I've been working up here. It's just an amazing group of people, incredibly talented and knowledgeable. I couldn't have asked to work with a better director and deputy teams and chief deputies. It's just an incredibly dedicated group of people.